Hi, I'm Katie, 3-time NICU mom turned medical mom turned podcaster. I've spent way too many days in the NICU, and it's changed my life forever. I've been the terrified mom with 1,000 questions and no one to ask. So now I talk about it. On the Tiny Titans podcast, I say the quiet things out loud. NICU guilt? Yeah, we go there.
Mom guilt for sure.
God moments? Absolutely.
God, no. God's wonderful.
This space is for NICU parents and the people who love them. Let's tell the truth. Let's tell the stories and let's pass them on so the next NICU parent knows they're not alone and maybe finds what they need just when they need it. Like and subscribe if you're on a NICU journey too. You're not alone. Welcome to the Tiny Titans podcast. I am so glad you're here. Hi friends. Welcome to the Tiny Titans podcast. It is the 10th episode. Cheers. Today, I want to talk about parent advocacy. I am still in contact with the NICU, and I volunteer to talk to moms who are in the NICU right now. And I'm noticing a big thing is that it is difficult for parents to know where the line is with advocating for your kid. First of all, advocate. What does that even mean? That was the first thing that I thought when I heard it. I had heard the word advocate before, but in the NICU it means more. It means more than just to advocate. And in preparation for this episode, I looked it up. Basically, to advocate is to speak up for someone who can't speak up for themselves. And it is used in different ways. So, as in, like a witness would advocate for someone in a courtroom setting. In this case, we're literally making decisions for a person who cannot choose these decisions. And so it's heavy. It's a lot to kind of process and to feel the weight of that, especially in the NICU, because it is sometimes life or death. Like, honestly, 100% life or death situations. And there's not a lot that you can do besides speak up. So we're just going to talk about that today in a couple of different ways. So first, when I first heard advocate for your child, you have to talk for them. I knew what that meant, but I didn't really know what that meant, especially when I was in the NICU with Cassie. When I was in the NICU with Cassie, it was only 21 days, and that seems like a lot at the time. When I was there, this was a huge traumatic event for our family, for me personally. I had to have a C-section that I wasn't planning. I had to stay in Chicago, very far from my house, and it was a big deal. And I did not know, I can't tell you one time that I can think of really that I advocated for Cassie. I really felt like things were changing and moving so quickly with her that every day was something new. I could hardly keep up. She was getting better and better and better. As a 32-weeker, she just needed time to grow. So as she grew, every 2 days or so, she would hit that next marker. And they would talk about going to the next phase. And then we would go to the next phase, and all of a sudden we were going home. So I remember there being a couple times where I didn't know what was going on. I didn't know how to handle it, and I wasn't sure who to talk to. But it wasn't really a situation where I needed to say. It was more a situation where I was overwhelmed with this situation, and not a situation that I needed to tell anybody anything. Like, in some instances, one instance I'm thinking about is when they moved Cassie from the NICU to like the step down unit, and we were preparing to go home like the week before. I didn't really know what that meant, and it was really scary to me to go from a NICU of like a bunch of isolates and a bunch of nurses on the floor, and then we went to a private room, which we could have had a buddy, but we didn't at the time. At the time, she had the room to herself, and it just happened that this happened on shift change. So that was like we moved, and then there was no one on the floor. Everyone was at notes and shift change and taking report, and I had no idea what to do all of a sudden in a big room with my baby that I usually had to ask to do something with, or someone else was in the room with me when I was doing things with her. So I was terrified, and I didn't know what to do, and I didn't know how to advocate for myself. I didn't know how to advocate for her. I didn't know what I could say, what I couldn't say, and all of this got worse. It's more intense when it's a tinier baby, a sicker baby, and a longer NICU stay. With a longer NICU stay, you really have to continuously show up, because there's a lot more ups and downs. There's a lot more, these things happened and we're gonna wait for these things to happen. There's a lot of waiting and in between things that are happening. I don't like how this camera looks, and I'm going to fix it. Okay. I don't know if that changed anything, but it made me feel better. So, oh no. So, okay. I didn't know what it was when they told me to advocate for my kid. And you kind of have to learn how to advocate for different phases of your child in the NICU. If you have a super teeny tiny preemie, micro preemie like I did, where the first couple weeks, maybe couple months, you're not allowed to touch them really, then just touch them. You're not allowed to hold them for very long if that's too strenuous, or if they're too sick to be moved and things like that. The advocating looks different, because you can still speak up. You can still ask questions. You can still be present. In fact, there's very little things that they should be doing with your child, to your child, without you present. You're allowed to know everything. You're the parent. You're the guardian. You're the team coach. They are on your team, but you get to call the shots. And the only time that is not true is if there's an emergency situation. If there's a code of some kind and stats are tanking, then it's best for the parent to step back, because they switch gears. All NICU staff switch gears when a code comes into play, and they go into go mode, and they have protocols in space so that everyone knows what to do, how to help. And sometimes parents can get in the way. I have been in the way of a code, and it's just something that happens. But barring an emergency, you should be able to be next to the isolate whenever you want to. You should be able to do cares whenever you want to. You should be able to assist in any procedures, any therapies, and it should be encouraged for you to do so with your child. Because when you take them home, you need to know. You need to know how they act for physical therapy. You need to know how they act for feeding therapy. You need to know all of that so that you don't have any surprises. Because when you take NICU babies home, it is very easy to fly off the handle immediately when anything goes slightly different than you think it should go. So you need to know a lot of information before you go home. And a good way to do that is to be so hands-on. Be right there. and to ask all the questions. One time a nurse told me, because I had it in my head that nurses work in the NICU all the time, doctors are in the NICU all the time, they should know exactly what to do all the time. That is not true, because more than 50% of the people who I talk to have never had a baby in the NICU, have never been a parent of a child in a hospital. And that changes your mindset as a parent and then as a person for like your experiences and how you move through life. So NICU nurses and NICU neonatologists and therapists, they know a lot, but they don't know everything. And the things that they would do may not be what you would do. So I was telling a nurse that she should know more than I would know. What would she do in this circumstance? And she said, I've never had a baby in the NICU. I don't know. This is not my wheelhouse. She's trained as a NICU nurse. She goes through a lot of training to do what she has to do on a daily basis. It's very specialized. It's very detail oriented. It's very communication oriented. It's a very difficult job. But the emotional part that gets layered on top of that from being a NICU parent, especially going through some sort of traumatic birth, if you've had preeclampsia or a C-section or anything like that, a breech birth, all of that is going to layer emotions on top of your decisions. That's not a bad thing. It's not a bad thing, because your emotions are there as like a guard dog for the situation. And if you have like some knee-jerk reaction or some feeling about a situation that's going on, that might be something that you should pay attention to, because it's usually not wrong. In the NICU, they talk about trusting your gut and your instinct and your feelings, especially as a mom to a child. There is an unmeasurable chemistry bond between the two people, even when they're not together. So, especially like right away in the newborn type phases, before like their due date would be, a NICU baby needs to be with their mom as much as possible. Like, more than a newborn needs to be with their baby, because you are it. You're all they know, and being thrown into this new environment is sort of traumatic. It is time for NICU Now. And today's very important preemie VIP is Connor. Mr. Connor was born at 26 weeks, and he spent 130 days in the NICU already. He was able to go home on oxygen, but he caught a cold, and that turned into bronchitis, and that turned into pneumonia, and he has been in the PICU now for a couple of weeks. He is getting better. His numbers are doing really well. He's able to kind of wean off some things, but he still is sedated. He is still intubated, and he needs some time to heal. So if you feel moved to help this family, which Connor is one of 4, his mama has 3 other kiddos. If you feel moved to help this family who is in the PICU, once in the NICU, their GoFundMe information is in the comments, and also his mom is starting a t-shirt fundraiser, and I'm going to put the information for that in the comments as well. So if you would like to help this family, help Connor while he's in the PICU, please jump down to the comments and click those links. Back to the podcast. I want to tell you a couple of my advocating stories. All of these happened with Carter because that's my biggest experience to pull from. I want to tell you a couple of those stories and then we'll kind of just like move over from there. But I get questions in this frame of mind about what can I do, what can I say, what can I ask, and if it's not working the way I want to, what do I do? Who do I go to? How do I get to the solution for what is the problem in my brain? And for my kid, because your kid could be having a myriad of issues and you don't know exactly because it might not be super important at that time. So, all that being said, here is a advocating story that I was wrong when I was trying to advocate. So when Carter was super, super tiny, I think 23 weeks, she might have been about a week old, she needed an IV and she could not get an IV in normal places in her wrists and her legs and things. So they were trying to do a cranial IV. The nurse is a friend of mine. She is a great nurse. I very, very much like this nurse. Other parents that I know also like this nurse. She's an amazing person. But she had not done an IV on a 23-week baby before. It just, babies at 23 weeks it's very hard to, first of all, find what you're looking for. You're using the tiniest equipment that you could even possibly comprehend to be using, and it's very hard to do. Also, they were trying to be very, very sterile, and so she was also using like double gloves on her hands, and dexterity is hard. It's a very small thing. I understand all of this stuff now. In the moment, what I perceived as happening was a person that I barely knew was trying and failing to put an IV in her, which I knew she needed, but I was like, get somebody else, find somebody else. Let's have someone else try at this point in time. There was no one else. And I sat and I watched them, the team. There was not just the one nurse. It was one nurse, the head nurse, who was trying to actually put the IV in, but there were 3 other nurses who were looking, keeping Carter calm, all of the things. And as all of this was happening, I was just sitting in a chair quietly about, 50 feet from the isolate where all of this was happening. And I was getting so frustrated because they wouldn't try anything new. But that was because I didn't know that there was nothing else to try. There was no one else to call. No one else had done this either. And with tiny babies, you have to just let them try because there's nothing else to do. If they don't try, they're not going to, first of all, learn, and second of all, then it's just they have to try. So I was wrong when I spoke up that time. When I spoke up, I said, we've been going at this for a really long time right now. Is there like something else we could do? And one of the other nurses, who I love dearly, kind of like hooked her arm through my arm and just like started leading me out of the NICU. And I was super confused and I was like, what are we doing? I was talking. And she kind of just like quietly like hushed me through the NICU and like talked me through what they were doing, how they were doing it, why they were taking so long. And part of it is because preemie babies need a lot of breaks because they don't want to stress out their nervous system. So if they try and they don't get it, they might wait like 3 minutes and like discuss and then try another time. Like give her time to calm down. So I was wrong. They were doing all that they could. I was an over emotional NICU mom, and I wasn't like wrong where like I was belligerent and I got kicked out and nothing like that. I just, knowing what I know now, I would have just waited. I would have stepped out. I would have let them work, instead of interrupting and hovering. That was not correct of me. So that happened. Another story, which hits with a lot of NICU parents that I know, is what do you do when you butt heads with a nurse? And what do you do when you feel like you don't want that nurse to ever touch your child again? Okay, so real talk. This did happen to us one time, and I did have to have a nurse removed from Carter's service. So there are hospitals where you can kind of pick and choose nurses. They might have enough staff for that. This hospital was not that way. You really have to have evidence, like documented, like this happened, yes, this happened, or like someone else was there and saw this also happening. My experience, very different than other parents, is it took a couple of days for all of this to happen. But basically, I met a new nurse that Carter had not had before, and that's always a red flag for me because I feel like I need to tell them a lot more than like history and backstory about her. So I was trying to kind of do that, and I was trying to help with cares. I was trying to ask questions like I always do, and she was sort of like boxing me out and like reaching over the top of me, like kind of like I would kind of like move over and she would sort of like put a hand up to kind of be like, don't touch that. Like I didn't know what to touch and what not to touch. By the way, this was like month 5. Like we had been in a NICU, had gone to another NICU, and we're back at our original NICU at this point. So, she also just wasn't like answering my questions. She was very much like in her own like little world, sort of buzzing around Carter's isolate. She was very attentive to Carter. But it felt like she didn't know what she was doing. And then the answers that she was giving me were not correct. Like, I know what she should be doing for her cares. And the answers she was giving me were very vague and I was like, that's not how we do things in the NICU. I need details. So, that kind of like set the tone with her. Then we got to rounds where the neonatologists were rounding, the actual doctors are rounding on all the patients. And I have a reputation kind of knowing my kids, and I'm pretty good at like remembering all their stats and their medications and things. So it was kind of just like a joke at rounds that they would ask me questions because I also had like a book with all of the stats and information, and she kept kind of talking over the top of me during rounds, which another nurse kind of saw. And I was irritated, but I sort of was like, okay, I'm not going to make a big deal of this. Different personalities. I'm trying to like let everyone learn. She's a very preemie baby. I know that people want to learn from her and see her case. So I was trying not to make waves, but I was very irritated about being talked over, not getting my questions answered, sort of just being pushed aside consistently. Just from this one nurse. Other nurses who knew me would come up to me and talk to me, and that nurse who was working on Carter would kind of just be like quiet and not pay attention to our conversation. So she had her for that one shift, and the next shift it happened again, to the point where it kind of got to like a little bickering between me and the nurse, where I was saying we need to do things like this because she's got a rash and she had tape around her thigh for her PICU, and I was trying to do things a certain way so that her eczema wasn't going to spread and things like that, and she wasn't agreeing with me. And anyway, it was very evident that this nurse was not very team player, and she was more about having the right answer in front of her superiors than having the right answer for me, which is a no-no. She's my kid. I'm in charge. I'm the coach, and she was not being a team player. So after those couple of interactions that I had with her, I talked to the nurse who was at rounds the first time, and she said that I was not the first parent to have issues with this nurse. So I went directly to nurse management, told them exactly what had happened, all of the instances. I brought the nurse who was at rounds with me to say, yeah, it was a very weird bedside manner. I don't think she was giving the correct answers, and those types of things. So that nurse did get pulled from Carter's service, and we did not see her again. So it can be done, and it needs to be done. If you have a nurse or a doctor or a therapist or whoever that is not being a team player, is not like explaining things, if a medical professional needs a parent to be on board with something, then they need to do a better job at explaining what's going on, rather than bullying the parent into just, this is how it's going to go. No. Why is it going to go like that? How long is it going to go like that? What is going to be the outcome after we do all of this? So all of that has to be taken into account. So if you're having like bad vibes with someone, bad vibes happen. They might be having a bad day. You might be having a bad day. But if you have a few instances, a couple of experiences with the same nurse, and you're like, this is not right, I don't like this, bring it up. Bring it up to a charge nurse, a shift manager, a social worker. All of those people will be people who can help figure out that situation, hopefully to a solution that you as the parent are comfortable with. Okay, I have two more stories. One story is about pushing for breast milk. I'm not gonna beat around the bush. I think that if you have breast milk, donor breast milk, your breast milk, I think that should be given to the baby. I think it's best for the baby. I think that's the way God designed it, and I think God specifically created it and continuously creates it through the mother to give special nutrients to the baby. I think that's scientifically sound. I think it's proven and factual, with evidence that I can give you based on my breastfed babies. Not breastfed, I pumped, but they ate a lot of breast milk. So in the NICU, if you don't have milk, you have the option of donor milk, hopefully most of the time, unless the banks are super low. And also formula. Even if you are giving your baby breast milk, they will probably fortify it with formula, which basically means mixing it in together to give your breast milk more calories, more fat content, so that your baby can get as much as they can with the little bit that they're getting. It's not a bad overall plan. When it comes to be a problem is when the reflux gets worse with the formula than it is with the breast milk. Preemie babies are not like full-term babies. Their tummies are not ready. They're not ready even for breast milk. And we're doing all of these things so early. And NICU babies, even full-term NICU babies, probably have some sort of trauma that they're trying to like process. Breast milk is better for cleaning out all of their digestive system. Formula is very beneficial for plumping up tiny babies. All of my babies were on it. But after I was able to get them off of the formula part and only on breast milk, their health improved dramatically, including their feeds, their feeding time, their bowel movements, everything. All of it improved in about a 24-hour period. Everything improved with taking formula out of their diet. I am not anti-formula. I'm fed as best. You know Carter has a G-tube. You know we use blended foods. You know we've used formula. I am not against it. I'm just saying I think that if you have breast milk, you should use breast milk. And in the NICU, you're going to get several different opinions about that. And the person to talk to, if you are concerned about that, to advocate for your child is called the milk technician. The nurse, in some NICUs, the nurses are the ones that mix the milk and the formula and get the bottles ready. A lot of neonatal units are going to specific milk techs so that they can measure everything. That's the milk tech's job. Not just measuring how much formula, how much breast milk, but then also measuring with their instruments the fat content, the protein content, the water content of what they're giving the baby so that the babies can get a more specialized diet. It's really cool. It's really technical. And I talked to our milk technician at our hospital a lot. Shout out David, because you're awesome. And I totally talked his ear off about, well, what about this? And what about this? And protein this and protein that. And what about this kind of formula? Which we had conversations about bovine formula versus human formula versus goat formula versus breast milk, and all in between mixes, because Carter had really bad reflux for a really long time and she was losing weight. So we had a lot of like playing with her diet to try and figure out what worked. And I'm telling you, in the end, when we were able to take formula out entirely, her body healed itself and she no longer had reflux problems. Colby was the same way. As soon as we got her off of the formula, which was mixed into her breast milk, she stopped with the refluxing. Cassie was the same way. As soon as, the only thing we had problems with Colby and Cassie was they needed to be propped up a little bit because of their preeminess. But the amount was way less. The occurrences were way less often. Night and day. So if you feel like you need to advocate for what's going in your preemie's tummy, talk to a milk technician. It's great. Last story. We had a care team meeting. If you don't know what a care team meeting is, all of the medical professionals who are working on your baby are on your baby's care team. Especially like you'll probably have like neonatologists that go around robin, all sorts of things. They are on your care team. And therefore they help create your baby's care team plan. You should be having care conferences and things like that, especially if you are at the NICU for longer than like 3 to 4 weeks. You should definitely like have like a group meeting, which is what this is. It's a therapist, a neonatologist, maybe a child psychologist, the nurse for you, and some other people who are helping develop the care plan in a very well-rounded way for your child. I was in a care meeting one time with 2 different pulmonologists. Also, this was one of Carter's big care conferences. We were talking about whether Carter was going to get a tracheostomy or not. We had 2 pulmonologists in the room. We had her neonatologist, her nurse, her speech, her physical therapist, all in the room with me and my husband, as well as on Zoom, we had neonatologists and dietitians, and I think a pulmonologist. There was 2 or 3 people on Zoom from Ohio, because Ohio is one of the best places in the country for neonatology. It's just, they have the greatest ideas, the best equipment. I don't know, that they have like the greatest ideas. Groundbreaking work is coming from Ohio and Iowa. So they were on Zoom with us, all of us together, like 10 people, trying to figure out what to do if Carter should get a tracheostomy. And basically, the 2 pulmonologists that were in the room with us were saying that they would have already gotten her a tracheostomy. Just go do it. Do it now. That's the next step. That's the next thing to do to get her to go home. Tracheostomy, weaning down, go home. And I was very against it. My husband was confused as to why it was such a dramatic, why can't we just wait it out kind of thing. And the neonatologist and specialist that we had on Zoom were saying that they would wait. So now I'm in the middle of a care conference where my husband and I have to make this decision, whether she's going to get this surgery. This is what we're making this conference for, is to make this decision. And we have specialists in the room that are telling us to do it. They don't know why we're waiting. And specialists at maybe a higher level NICU or deals with definitely smaller preemies at this other hospital telling us to wait. So what do you do? What do you do? Okay, what we did was we asked so many questions. We asked, would you do this if it was your child? We asked, when would you have done this? When would have been a good time that you thought the surgery would have been necessary? What was the earliest you think she should have gone? Do you think waiting would be any benefit? The questions went on and on and on. And we asked the same questions of everyone who we could find. Parents who had kids who had a tracheostomy, who had already graduated from a trach, who had to be in the same position as we did and chose not to do a tracheostomy. What I was hearing from my NICU mom friends was that if they start talking about trach, do it. Don't put a block in your head. Don't try and drag your feet. Do it. Do it as soon as they start talking about it, because the earlier you do it, the sooner they're going to get over that and recover, and the sooner they're going to get home. And I totally understand all of that, but that was not our experience. Our experience was that Carter just needed more time. And she proved that by pulling her ET tube out 2 days after this care conference. She pulled her ET tube out and she never had to be reintubated. So, really, really big miracle there. But that was our answer. We had already sort of made the decision that we wanted to wait, and we were sort of trying to buy time by asking more questions of different people around the country, different specialists who we could email or Zoom or anything. And she ended up pulling her ET tube out and not having a problem. That never happens. That never happens. So crazy. So crazy that happened. But if you feel like you should wait on a procedure, wait. If it's not emergency, this was elective. This is the next thing that we need to do to get your baby to go home. When are we going to do it? When are you going to sign the papers? That's not emergency. we really wanted to see what Carter was going to do. And in Carter's story, if you go listen to Carter's story, she was a wait and see kid. She still is a wait and see kid. She shows some subtle signs, and it's really just wait and see and then go. So in this case, I'm really glad that we made the decision that we made, but technically we were going against medical advice. We were going against other NICU parents and what they were saying to do, but it's what my husband and I thought was correct for our family and correct for our child. So a lot of the parent advocacy has to do with advocating for yourself. What are you willing to do for your child? What are you willing to live through? What does it mean to do what they're asking you to do for your child? So, kind of spin off of that, I have a mom friend right now who's in the middle of that. She has to drive 3 hours one way to see her baby in the NICU. And then she has to drive 3 hours home to see her 2 boys at home. And she's currently doing that and has been doing that for 6 months already. But like, she is doing that because that's what she is willing to do for her child. Like, maybe other parents wouldn't do that. Maybe other parents wouldn't be able to go back and forth, you know, but you have to decide what you're comfortable with, what you're ready to do for your child. And everybody is different. We're all going to make different decisions, and that has to be okay. But that is part of advocating for your child. And if you're talking to another NICU parent, you can't be mad at their decision. You can't be upset because of what they chose to do, because their situation, their experiences, and their child very different than yours. So it's just, you have to let NICU parents advocate for their own children. Give them space and information to do that. That's just what needs to happen. Now, I've got to look at my notes, but I have some questions that I've written down that are, these are very normal things that you should always be able to ask about your child. So this is just every day you should be able to ask. Is it hospital policy, or is it just this unit's routine? So is this like something that has to be done? Is this something that is easier done at this time than this time? Ask those kinds of questions. If you're looking for options and you're not comfortable with the options that they're giving you, ask for other options. Even just as simple as, I'm not understanding this avenue option that we're going with right now. Can we talk about some other options so I can maybe figure this out? You're allowed to do that. Other options like, can I be included in rounds? Can you wait for me for baths? Can we set up a care meeting? Can we set up another care meeting? Can we set up a meeting just with the social worker? Can I set up a meeting just with the physical therapist? Yes. All of that should be a yes. Again, you're the parent, you're the coach, they are on your team, okay? So all of that should just be regular, everyday, normal questions. Here are some bonus questions that I asked, that I like to ask, and just maybe having like the phrasing of the question might help you get some better information from your nurses and doctors and therapists. Okay, so here we go. Okay, hold on. Here we go. This sounds like flattery, but it's not. Based on your expertise, what is the most pressing issue for my baby right now? This is super easy. First of all, it's an open-ended question. So it's not a yes or no. They're not answering a scenario. They're giving you what they think based on their experience. So you're learning about them, you're learning about the baby, and you get to find out where their expertise is. Are they better at BPD patients? Have they had a lot of heart patients? Have they had a lot of like maybe more severe patients, like autism patients, or like I'm not sure, but everyone has a different experience and a different level. They could help you later, maybe not necessarily now. I have a nurse friend who I sort of found out in just asking open-ended questions like this that her little boy had asthma. Shout out Emily. And I didn't need the information that she was telling me really right then, but like a month or two later is when I went through Cassie getting her asthma diagnosis while Carter was in the NICU. And so I had a whole person that I could just go to and say, hey, what about this? What triggers about this? What medicines about this? Very, very, very easy way to get connected with your care team and find out like who can help where. Next question. Have you noticed anything new about my baby since you have had them before? Now, this is obviously for a nurse that is not the first time that has had your baby. But usually nurses go in cycles, or maybe they have your baby for like every day that week, and then they skip a week, and then they go back a week or two later. So they do that on purpose. Fresh eyes are good. Fresh eyes are good. So they might notice a rash or a cut or a mole or a freckle, or that their breathing is slightly more than it was when they had them 2 weeks ago. It could be very small, but it could be a lot of information, again, for you as the parent, and giving you more things that you can advocate for your baby for. Another question. Have you cared for other babies with this condition, and in your experience, how did that turn out? Again, this kind of bounces off their expertise question, but if they have expertise about heart patients, maybe CHD babies, then they might not know a lot about the pulmonology respiratory side of things, but you know what I mean? Like, they could have had another baby who had a respiratory issue and it was similar to your baby, so that's where they're thinking this happened with that kiddo, so maybe this will happen with this kiddo. Now, I'm not comparing babies. We just want to have open options of what does this look like. Okay, so we just moved to CPAP. What does that look like? How long will they be on CPAP? What levels are we going to be on while we're on CPAP? And where do we need to get to for the levels for their pressure and their oxygen before we go down to the next level? All of those could just be answered from a nurse who's already had a respiratory patient, who already had a tracheostomy. I had one of our nurses, shout out other Emily, you know who you are. She was a BPD nurse, and she knew a lot about kids who had bronchopulmonary dysplasia. She had worked a lot with them before Carter had BPD. So she knew kind of tricks and things like positioning, and like tightness of clothes, looseness of clothes, propping up and things like that, that were very helpful to get Carter to breathe and stat the way that we wanted her to. So all of those are good things. Okay. Other questions that might be super helpful for you. What do you expect the next 24 hours to look like for my baby? This is especially helpful if they're in like either a wait and see period or a crisis period. So I asked this question a lot when Carter was sick. She was sick the December we were in the NICU, and it was really bad. It got really, really bad. She almost died. A couple of different times they called us in and said that we should say goodbye. But at the end of, like, we had to leave, she's still as stable as she can be. That was a question that I asked. What are you expecting? More of the same? Have you seen any sort of improvement? Have you seen her working harder? All of those can be questions coming from this question. Is there anything that you think that would help her right now? Again, this could just be feeding type issues. If your baby is just a feeder grower, that's what they call bigger babies who don't really have medical issues. They just need to learn how to eat, maybe learn how to regulate their body temperature and go home. So feeder growers might have different milestones. Nurses treat them a little bit differently, obviously, than babies who are sicker, tinier, need more care, okay? It's just a really good question to ask, like, how are you going to handle this situation is kind of what you're asking. So, again, more information for you as the parent. Now, this is a no-no. I'm going to tell you not to ask this question, okay? What would you do if this was your child? Do not ask that. They don't know. They don't know. You will not know. It's one of those life and death situations. You will not know what you're going to do if you're in a car accident. What happens if a person comes into the grocery store and points a gun at your head? You do not know until you are in the situation. So if they have not had a baby in the isolate, in the NICU, they don't know. They don't know the emotions that they're going to feel. They don't know the triggers that they're going to get triggered because of that. So it's just don't ask. It's going to muddy the waters for you. Don't ask that one. Is there anything that I can be doing right now that would help her development or bonding? That's actually a really good question. And you can ask several different people because different people will give you different answers. So a speech therapist is going to tell you, obviously, feeding questions, oral issues, and things like that. A physical therapist is going to tell you, hold her like this. Gently give her stretches like this. Make sure she's swaddled or unswaddled, depending on your baby and how they're doing. But all these are tips and hacks that you can carry home with you. You don't have to just use this in the NICU. It's just information for you to use later on in your and your baby's life together. Bonus questions. Can I write a note for rounds? You know what? That's not even a question. You should have. I encourage you to get a whiteboard. They have whiteboards in every NICU, I'm pretty sure already, but get one that's yours so that nobody else writes on it, nobody erases what you have on it, and put what you think is most important for your baby on that whiteboard. I'm going to put a picture up of what I put on my whiteboard, but things like I like to have lots of breaks when I'm taking my bottle. That's good information for a nurse to know. I don't like poopy diapers. If I'm crying, I'm probably poopy. That's good information for a nurse to know. I like to rip my IV. I like to grab things. All good information for nurses to know. That can all just be posted in your baby's room for everyone to see. So if there is a code, if there's a code and your nurse is helping another baby and your baby is having some sort of fit, it's posted right there. So maybe the nurse doesn't know your baby that well, but it's posted. I'm going to encourage you, put it on poster board. Make it super pretty, or make it on a whiteboard so that you can change it all the time, or whatever you would like to do. But put what you think is most important that your baby would be telling your nurse, okay? Maybe it's, we're getting ready to go home, so please practice these things. Maybe it's a binky. Maybe you really want them to be able to have a binky when they go home. Or we're getting ready to go home, so please try and make sure that they have a good nighttime schedule. And then please tell me what you're doing for their nighttime schedule. So it's all about communication. Advocating is all about communicating with your care team about who's taking care of your baby. So all of these questions are amazing, useful tools that you should use. On the very end of this, because I'm winding down, I just had a thought. Advocating for your baby from a distance when you cannot be there every day or for all day. Maybe you can only be there for 2 days at a time and you have to go back to work. All of these are real life situations that real people are dealing with all the time. And if that is a situation that you need to deal with, you have to figure out how to advocate for your baby from afar. So some NICUs have camera systems where you can just go onto an app and you can see your baby in their isolate almost all the time. Not all NICUs have this. Some do. That's a great way to check up on your baby. But calling at shift changes, at care times or after care times, you can even ask, like, when is a good time for me to call? Like, a good time at my hospital where we were at to call was like 9-10 o'clock at night, because it is sometimes during cares, but it's after shift change, it's after reports, it's after everybody has kind of gotten used to their baby, and it's before everyone starts taking lunches. So if you don't want to stay up until midnight, call at 9 o'clock and find out about your baby. And you should usually have like a good, like, kind of routine schedule for, okay, I should always call at this time, or at nighttime I should call at this time. You can even put things like this in your chart if you're far away. Put things like, please call mom at 10 o'clock before or after you do cares, after you put the baby down for bed, so that she knows what goes on through the end of the day, because that takes the pressure off you. That lets the nurse know that you want that information, you're waiting for that information, and they're not interrupting you or interrupting your sleep. You know that they're calling, they know you're waiting for it, and you're not interrupting them trying to take care of other babies. I did that with Carter on the very last 2 months that we were in the NICU. Super helpful. It made a weight off of me, kind of like a little NICU date with me and the NICU nurse was kind of fun to do. So that's one thing you can do to advocate for your baby from afar. Trying to get information as information is happening is not really something that can happen when you're far away from your baby. Usually, I was an hour and a half away from Carter when she was in the NICU, and from Colby, and from Cassie. So, when Carter pulled her ET tube out, I was not told during. I was told after she was stable. That is to be expected, okay? Something crazy happens, let them handle the crazy, and then expect them to call you back. Bonus points for that nurse, she actually was able to FaceTime me, so I could see with my own eyes that Carter was doing fine, that she was sitting up and not laboring and things like that. But that's another way that you can advocate for your kid. You can also set days when the nurses know that you're coming in. That can be a good thing and a bad thing, but if the nurse knows that you're coming in, then they can do the fun stuff when you're there. They can do the bath. I would call and say, hey, I'm going to be there in an hour. I have a bunch of milk and I would like to do pictures today. So then they know that you're going to be there. You want to be hands-on. You're going to need help and all sorts of stuff. That's just communication. Advocating for your baby is communicating with your care team. Finding out who your care team is and just continuously checking up on that all the time. So, well, I have been yakking your ear off for a while now. I think I have told you all of my secrets by now. I don't know if I have more. If you have questions about this would be a great time to shoot a comment in the video, to send an email to the Tiny Titans podcast at gmail.com. Or you can find me on TikTok, or pick a place you can probably find me. You can ask any question you want. I will find the answer if I don't have it. I'm going to give a little disclaimer here after I've given you all this medical advice. I am not a licensed professional. I'm not a doctor. I'm not a nurse. I'm not a therapist. I'm just a NICU mom who has a lot of experience and has been to a lot of therapy sessions, a lot of care team meetings, a lot of NICU events, and I just have a lot of experience with this. And if you are a NICU parent who is looking for this type of information, subscribe. Subscribe right now, because I'm going to keep giving this kind of information. If you're a NICU parent who has questions about this kind of information, subscribe so that I know who you are and I can say hi and I can reach out to you. If you're in the NICU right now, if you just got home from the NICU and you have questions, subscribe and I will help as much as I can. I am plugged into NICU networks, even if we're not in the same state, even if it's not me that you talk to. Maybe you have a problem that I don't have any experience with, but I bet you I can find someone who has that experience. So we can find these answers together. So we're going to just be the community for the NICU. We're going to advocate for our babies. We're going to advocate for ourselves. And we're going to have a drink, because you probably need a coffee or a Dr. Pepper. See you next time, guys.